This is Ame Duse presenting on a prick-free glucose monitoring app. Something I've heard multiple patients at my community site say is I'm tired of having to prick myself every day, multiple times a day. This could potentially result in non-adherence due to the fact that some patients may be instructed to test their blood glucose up to 5 times a day. Another barrier to modern day blood glucose monitoring is the need to purchase multiple devices to get blood sugar readings, such as test strips and lancets, which both can only be used once before having to be disposed of, as well as a monitor. Other alternatives like Dexcom and Freestyle Libre are sometimes not covered by insurance and still require blood through a tiny needle attached to the sensor. My solution is an app that uses a camera lens to read blood sugar levels. It would not require blood and only requires the user to have a smartphone, which about 81% of Americans have. The ideal user persona would be tech savvy, recently diagnosed with diabetes, meaning they are not used to having to prick themselves every day, owns a smartphone, and is either pre-diabetic or diabetic, resulting in their need to take blood sugar levels. An example of an ideal persona is Angela. Angela is a 24-year-old millennial who is recently diagnosed with pre-diabetes. Diabetes runs in her family, resulting in her desire to presumptively monitor her blood glucose levels. She believes her yearly doctor visits aren't frequent enough to actively monitor her blood sugar levels. However, she does not want to commit to purchasing a blood sugar monitor, which would expose her to her fear of blood and needles. A blood sugar monitoring app would be perfect for her. So how can this idea be tested and implemented? Before development, we will deploy surveys to diabetic patients when they receive their medications at pharmacies. These surveys will gauge the interest of the patient in the development of a blood sugar monitoring app, as well as provide a prototype, which will be shown on the next slide, of the app's layout and what it would offer. The actual mechanism of the app can be tested based on previous attempts of developing this type of app, where researchers created an algorithm to help the camera lens interpret blood sugar levels from the series of photos taken by the camera. There would need to be clinical trials that would compare readings from the app to readings from blood glucose monitors in order to determine accuracy. In order for it to be implemented, it would need to be incorporated into the App Store. This is a prototype of the app, which includes the beginning patient login page in order for patients' information to be secure, followed by the main page of the app. The main focus of the first page is the patient's most recent blood sugar level reading. There are also tabs for allowing the patient to take a new reading, which would open up the camera lens, past readings that would include all patients' past readings, as well as average readings based on the time of day it was taken, as well as tips on how to prevent blood sugar spikes. There will also be a discussion board where people who use this app can speak about their experiences, provide feedback on the app, and give each other tips on how to manage their diabetes. In the beginning, there may be a gap between innovators and early majority. As we know, innovators are usually more tech savvy and willing to try something new and a new approach to their lifestyle. The early majority will most likely be long-term diabetic patients who are accustomed to their blood sugar monitoring routine and are more hesitant to change and try something new. We will bridge this gap through marketing, which will show the free cost of the app, resulting in it being accessible to all. We will show how it is a pain-free alternative that does not have to deal with needles or blood. Furthermore, we would show it is user-friendly by providing pamphlets to diabetic patients on step-by-step instructions on how to use the app, resulting in the ability for all smartphone users to be able to utilize the app.